is Professor of Social Mobility at Exeter University, also a father of two teenagers. And Christina Pagel is Professor of Operational Research at University College London. Christina, give me the reaction to the idea that it is pretty inevitable that children are largely going to get this disease and gain their protection through exposure to the virus itself.
Well, I think it's very defeatist. We don't need to do that. We know already that immunity from infection is less long-lasting and less robust to variants than immunity from vaccination. We know that vaccination in teenagers is highly effective and safe. The US has vaccinated 8 million of its teenagers already, and it's being rolled out across Europe and Israel as well. We know that trials are currently underway in the under 11s for Pfizer, Moderna, and AstraZeneca. So currently, about 25% of children might have immunity from COVID through previous infection. To get to population immunity, that you need that to get up to about 80%. That's another 7 million children in England. Are we really saying we want 7 million children to get COVID over the next 6 months, with potentially 7% of them, so 500,000 of them, ending up with symptoms for more than 3 months from ONS? I mean, I think that's unconscionable, and the disease that we still don't know what the long-term impact is when we know there's a safe and effective vaccine on the horizon.
Right. So, Christina, take us through what you do right now, because we clearly do not have the vaccines right now for the children. I mean, really, we'd be talking on it with a fair wind of maybe vaccinating over the course of next term, I'm guessing. What would you do? Would you carry on with kind of quite extreme measures to prevent infections, for example, via bubbling?
I mean, I think the problem is that we haven't made schools safer, and we didn't invest in making schools safer all the way through January, February, March, when schools were shut. So things like better ventilation. New York is currently putting and paying for air filtration in every single classroom in New York. We're not doing anything like that. We're not investing in our future for ventilation. We got rid of masks, which are one protective feature. We know ultimately that the best way of keeping schools safe is to get community transmission down, and we're making no attempts to do that at all.
Other than by bubbling.
Well, not just bubbling, but other than vaccination is the only strategy we have.
I see. Yeah.
So, I mean, if it was possible, I would prefer to see much smaller bubbles, which is what they do in many countries on the continent, so that when a child tests positive, far fewer people have to isolate. But that, of course, depends on resources and support for schools to allow them to have smaller bubbles.
Let me turn to Lee, Elliot and Major. Take me through the argument around bubbling and the cost you think that is being incurred among children for that.
So our research is showing that there has been huge learning losses over the year, more than a year of the pandemic. And that is hitting the poorest pupils the most in all this. So there's a real social equity question in all this, I think. And what we're trying to balance here, as always, is the immediate public health concerns against the long-term scarring. And we call it scarring. You know, our studies really point to huge catastrophic impacts of this pandemic on education. And so I, among many others, I think in the education world, are saying, look, you know, we totally understand the public health concerns, but we're now at a point where we need to review this bubble policy. The problem with this policy at the moment is that we are seeing hundreds of thousands of pupils missing school every day. Lost is hugely damaging. And my view is that, and again, I don't have all the solutions, and this is something to discuss with health experts, I think, but I think we need to review it now, because if we defer now, then we're going to lose yet another 3 or 4 weeks when we've already lost so much over the last year. So I think it will be really disappointing if we don't address this before the summer break.
Right, because I think a lot of people would say, look, let's just, plough on through to summer. It is not long now to July the 19th when all the regulations are reviewed, and then pick it up in September and maybe do it then. But you're saying, no, look, really, you would just get rid of bubbling tomorrow. You would send home the infected child and anyone who they'd been in really close contact to, maybe someone sitting very close to them for long periods of time, for example.
Yes, I mean, it'd be interesting to know what Christina thinks, but I wonder whether we could have testing rather than maybe smaller bubbles, maybe testing. The reason I'm pushing on this is I guess I see the evidence on, education and the widening inequalities, particularly, as I said, the evidence suggests that it's not just all pupils, it's particularly those poor pupils. And we know they were already behind at the start of this pandemic. The pandemic has exacerbated and exposed inequalities. And we've got to remember this will affect a whole generation. The people that are going to suffer most in this pandemic, as far as I can see, are the under 25s. They will have lifelong damage. So, there's a generational sense of fairness here. What are we doing for the young generation? So I would push for trying to review this before the summer break, because remember, then everyone's away for the summer. And unfortunately, you see these gaps, these education gaps emerge over the summer months as well. So it's going to really be crucial in education terms.
Christina, you've heard that. You've heard the case made there. We're not going to get the ventilation systems built into schools in the next 3 weeks, however hard we try. That isn't going to happen. We'd be lucky to have that done by the end of the summer holiday. We might regret not doing it before, but we're not going to be able to get that done in 3 weeks, are we? What do you make of the argument that we actually just need to get moving on this?
I mean, I am incredibly sympathetic to that. I absolutely recognise that children and young people have had their education and their lives incredibly disrupted by COVID, and particularly as Lee was saying, in more deprived areas. But COVID is hitting more deprived areas. There's no doubt that if we abandon the bubbling system, it's only going to get worse in schools with high prevalence in their communities over the next 3 weeks. And that is currently the most deprived areas. I think the most deprived super output areas, 33% of them have case rates over 150 per 100,000, compared to only 7% of the least deprived. It's going to hit exactly those deprived areas the most, who are also living with people in more vulnerable situations health-wise and with lower vaccination rates. So you're actually creating a situation where all the disadvantages of having COVID are going to also fall on the more deprived people. What we need is for the government to make schools safer and commit to doing that, but also to actually support people to catch up on education. There was meant to be this big push last summer to do this from Gavin Williamson. It never emerged. We never got it. We never got support for people in deprived areas to have laptop support at home or free internet or any of the things that help people to learn outside of a classroom. So I would say, why don't we hold the government to account for putting us in a situation where we're not in a position to educate our children safely?
I mean, Lee, Elliot Major, it doesn't sound like there are any immediate solutions that are terribly, terribly attractive.
I do wonder, and listen, I'm not a health expert or a vaccine, but I do wonder whether smaller bubbles and maybe with some lateral flow testing in schools to just reduce the number of children that are being, and teachers actually, as the teacher was saying. And this is, this is a balancing act. I do understand that. I just, I'm weighed down by the statistics from education. I'm looking at them over the last year, and it just horrifies me. So I totally understand we've got to balance this. But I wonder whether there's some innovative things we could do before the summer break. I still think that.
Just one quick last one, Christina, just generalising this a bit. Are you worried that effectively the government strategy now is vaccinate the population, everybody who wants it, over 18, and let cases rip and just assume that we're not going to have many deaths and many hospitalisations? Yeah,
that is what worries me. And I find it really sad, because it just feels like we've given up and are saying it's fine for the under 18s to get COVID. And I don't think it is fine. There's plenty of evidence of longer term problems and lots of things that we might not yet know about. And not just that, but if you have, say, another 6-7 million infections in children, that's also 6-7 million opportunities for further mutation and anything that can then infect their vaccinated parents and relatives has a selection advantage. I mean, it's just creating quite a risky situation when we know that there are vaccines available. So not for the next 3 weeks. I accept that we cannot do that in the next 3 weeks, but before next term, we're in a position to really protect our young people.
Christina Pagel and Lee Elliot Major, this is really the debate. A bigger debate than just even schools, actually, a debate for the next few weeks. Thank you both very much.